Alright, so we're going on to actually look at the last type of ovarian tumors. We've been looking at the various categories where we looked at mucinous cancers, we look at serous cancers, we look at endometrioid cancers. Then I think there was one before the Brenner cells. So the Brenner Transitional epithelial tumors. Let's look at them. Now, for the Brenner ones, we are actually trying to subcategorize it into basically the advancement, So we'll look at the tumor, which is the benign. We'll look at the borderline one, which is in between being malignant and being benign. Then we'll look at the malignant type, all right, which is like harmful, So for the Brenner tumors, we say that they are non-cancerous, they are usually asymptomatic. Histology is a nest of transitional type epithelial cells within a dense fibrous stroma. So appearance is firm, is yellow-white mass, often discovered incidentally. So it's most of the times the person will even complain. All right, it's when you are doing other examination that you just say, this person has a Brenner tumor. Okay, so prevalence makes up about 1 to 2% of all ovarian tumors. Prognosis is excellent. So once you surgically cut this out, that's all for it. Now for the borderline one, that is what intermediate, so shows proliferative activity but no stromal invasion. So histology is papillary and polypoid structures. Okay, so this resembles low grade papillary urothelial carcinoma. Okay, so there's mild to moderate atypia. Clinical features usually occurs on one side, and sometimes the person might have pelvic pain, but sometimes when it's now increasing in size, cause all those compression mass effects. So prognosis is very favorable. All right, once you get it and you initiate treatment early. So malignant Brenner tumors, those ones are rare and aggressive. Histology, stroma invasion by atypical transitional, squamous or undifferentiated cells. It may resemble transitional cell carcinoma, which has a worse prognosis. Right. So those ones are malignant, so they can spread to other tissues, lymph nodes, the lungs, the liver, bones. Prognosis depends on when you found it. Okay, so that's what we have for the Brenner tumors. All right, type of ovarian tumors.